Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about the truth about chin surgery. And we're going to start off by talking about chin augmentation, and specifically we're going to talk about chin implants and genioplasty. And as this video goes on, we'll discuss other options of augmenting the mandible. We have a similar series on YouTube about the truth about cheek implants. So let's talk about the chin. The chin is very important, both aesthetically and for confidence. People with weak chins are often less confident, have less masculine in terms of males profiles, and beautiful people have very well defined chins, both male and female. And it is a very commonly augmented region in the face, and lots of great things have happened over the years with chin implants. They've become so much more predictable and viable alternative because of their anatomic construction. So there's a lot of questions to be asked about chin implants. Number one, why do we do it? Well, simply, you have people that have recessive chins, all right? And they want more chin projection. And in that case, a simple chin implant, and let's zoom in here a little bit if we need to, a simple chin implant is usually the best answer. These are silicone implants, and they are made on actual human bones, so they are anatomical in that they're made to fit directly on the mandible, and they come in a vast array of sizes and shapes for masculine chins, feminine chins, and unlike the old style button implants that were just a small piece of silicone, these implants again are contoured so that they blend in nicely and provide significant augmentation. So with the chin implants, I use silicone implants 100% of the time. They're anatomic in that they are made on human mandibles, models, and that means that they fit on here very nicely. They conform quite well to the mandible. Whereas the old style implants were just little buttons, these implants are elongated so that they can provide augmentation across the lower jaw. They come in a variety of sizes and shapes, and there's just, you can really customize your result with a patient because they're masculine chins, they're feminine chins, they're square chins, they're round chins, and it's very versatile. Now, one of the questions that comes up is what material is best? Again, I said I use silicone 100% of the time. And why is that? Well, silicone is a very biocompatible material that has decades of use in the human body. It's also bendable. All right, so if you use solid implants like the porous polyethylene implants, they won't necessarily bend to a contour, so they'll stick out. They can break if they are not flexible silicone. Flexible silicone is very easy to drill, to place a screw to hold the implant in, and there's various advantages to silicone. The biggest advantage is if you ever want to change the implant, it's very easy to remove, whereas the porous polyethylene implants can be very destructive to remove, and they can fragment and be very problematic. So again, I prefer the silicone implants. Now, another question I frequently get is, what's the best way to put an implant in? Through an incision under the chin or from inside the mouth? And the answer to that question is they're both fine, okay? I did about almost 100 facelifts last year, and probably a fourth of my facelift patients will have chin implants. So since I'm already operating on this area, I already have an incision in the skin. When I'm doing a facelift or some other platysmoplasty or submenoplasty, and I'm already having an incision there, then I will place that implant through that incision. If I'm not making an incision there, or if a patient wants to make sure they don't have any scars on their face, then I will place the implant through the inside of the mouth. And I've heard doctors say that you shouldn't place an implant from the inside of the mouth because of infection. I can tell you, I've done this for 30 years. I've placed hundreds and hundreds of these silicone implants, and infection is extremely rare. If there's an infection problem, it's more often not from a silicone implant, or it's from an implant that has mobility or some other problem. Now, anything in cosmetic surgery or in any type of surgery can get infected, so it's not impossible, but I can tell you from experience it's extremely rare. And the other thing that's funny, some surgeons will say, well, you should never put a chin implant inside the mouth because it'll get infected. But where do they put their cheek implants in? They put them in from inside the mouth, okay? So I can promise you infection is just no more common intraoral or extraoral. Chin implants are a great option for augmenting the mandible, and one of the really powerful things about facial implants in general is they are permanent, but they're reversible. Now let's talk about that. They're permanent, so what does that mean? Well, when I put my implants in, I always put at least one screw to secure the implants. Now, some doctors fixate them with sutures, which is better than nothing, but they can still be mobile. Some doctors don't fixate them at all, and I'm not saying anything about those surgeons, whatever works well in their hands, but I always fixate all of my facial implants with a micro titanium screw. And when we were talking about infection, or sometimes implants get a bad rap because people say it dissolves the bone under the implant, it is because of micro movement. And again, I have put in hundreds of implants, and when they're screwed in place, I don't see problems with, there's no mobility, and I don't see problems with bone resorption or bone loss. And I see a lot of problematic implants that were placed elsewhere, and people come here to have them fixed. And when I do see significant bone loss, it's 100% of the time with a mobile implant. So using single screw fixation is very important, and if there's a rotational component of the implant, I'll put in another screw, or sometimes a total of 3. And one of the other big problems about implants is the malposition. So when you put an implant in, it might be fine when it's placed, but if it's not fixated, and we might want to zoom in here a little bit, if it's not fixated, it can be placed like this, where the tails are kicked up. It can be placed like this, where the tails are kicked down, or very commonly, it can be crooked in this plane. So you have a lot of bad things that can happen if the implant is not fixated. And if it's fixated, I can promise you it's not going to move. So let's continue our conversation. Now, what if somebody wants to have their chin augmented, but what if they don't want to use an implant? Some people don't want anything foreign in their body, or for whatever reason they don't want to implant. Well, they would be a candidate for what's called a sliding genioplasty. And a sliding genioplasty is when you make an incision inside the mouth, under the lip, you make an incision across the bone, you take that bony segment and you move it forward, or sometimes forward and down. And so that's called a sliding genioplasty. Genio means chin, and plasty means to change. And that's a common way to address chin surgery. Now, some people say, well, should I do this or should I do this? If we're just talking about horizontal advancement, in other words, bringing the chin forward, I'm a proponent of using an implant. It's easier, it's less expensive, it's completely reversible, and most patients do fine with that. However, there are a lot of patients that would rather, or a lot of surgeons that would rather do advancement genioplasties, and it's more surgery. You're cutting bone. There's going to be more recovery, more pain. You have to use hardware, some bone plates to hold this in place, and it's not as easily reversible. So there's pluses and minuses for both uses. However, there are a number of patients that have not only the horizontal deficiency, but they also have a vertical deficiency. So in other words, their jaw is not long enough from here to here, and they have this foreshortened jaw, and they have a very short lower facial third. When we divide our face in thirds, you have the upper third, the middle third, and the lower third. And some of these people, they have a short lower facial third, and their chin is all bunched up like you're seeing on the onlay picture right now in the video. For those type of patients that have a significant mentolabial fold, which if on the outside of the jaw, on the facial skin, under the lip, that's that fold. If they have a deep mentolabial fold and a small chin, you can't do a chin implant. That will actually make the problem worse. In that case, you have to lengthen the mandible. So you actually have to make this jaw longer. And the only way to do that is with a sliding genioplasty. And we make the incision in the bone. We advance it sometimes, but for sure, we're making a gap there. And sometimes we'll put a artificial bone graft in there, sometimes we don't. But that allows us to make this jaw longer in the vertical dimension. And that's very important. And for patients that have short lower vertical thirds, that's the operation. Once in a while, I'll see somebody try and treat that with a chin implant, and it just looks
some people have
terrible. Too much chin. All right, so their chin is too big, and in that case, we would do a sliding genioplasty to put the chin backwards. So that's a little bit about the implant and about the genioplasty, and now we'll talk about mandibular angle. So what is a mandibular angle implant? Some patients have very nice sculpted jaw lines because they have a very sharp angle from the bottom of their jaw to the back of their jaw. And this is a common thing that people like, and they want that type of definition on their jaw. And if they don't have that, we can use a mandibular angle implant. Now, the implants are clear. This is just a model that I'm showing, and it shows up better for contrast. And this, again, is placed from the inside of the mouth, and it goes on to the jaw, and it sits under the jaw a little bit. And what it does is give not only the sharper angle back here, but it also gives thickness to the jaw. And again, some people just don't have that fullness or that angle. So that's what a mandibular angle implant does. Now, the other thing that we really haven't talked about are custom implants. And you can make custom cheek implants, custom chin implants, custom jaw implants. And what you do is we have a CT scanner in our office, or you can use a CT scan from a hospital, and it makes an actual model of your jaw. So this is somebody's actual jaw, and then we can customize an implant to make it much more specific. So we have total control, whereas the other implants are basically small, medium, large, and extra large. These implants can be made in any dimension. So this is just the model mock-up, and then we'll send this to the company, and they're going to make the actual final implant. And you can do this with the jaw, you can do it with the chin implant, and you can do it with cheek implants. So custom implants are more detailed, they're more expensive, and there's more that goes into them, but it's a great alternative for some people, especially people that want something very specific, or they may have an asymmetry or something larger or smaller that an off-the-shelf implant won't. I hope you've enjoyed this segment on facial implants. I've been doing implants for 30 years, as I said earlier. It's really fun. I've watched the implants evolve to where they are today. Silicone implants provide a wide array of choices and very natural and anatomic results. I think it's something that's fun to do, and we do a lot of them. I invite you to look at my website, lovethatface.com, and look at the chin, mandibular angle, and cheek implants, and there's a lot of information and hundreds of before and after pictures on cases that we have done. I'm a lucky guy because my job is my passion, and it's fun just to talk about it. This is Dr. Joe Niamtu, lovethatface.com. In addition to performing cosmetic facial surgery, I also teach cosmetic facial surgery, and we have a comprehensive course at my office and surgery center in Richmond, Virginia, twice a year, and we have doctors from all over the country and all over the world. We also offer a DVD series and have DVD individual titles from fillers to facelift, which is available on our website. I'm also very proud of my textbook, Cosmetic Facial Surgery, which has remained one of the best-selling cosmetic texts for doctors over the last several years, and proud to say that it has recently been translated into Spanish.